Hey there, I'm Dr. Travis McKay, and I'm one of the chiropractors at Advanced Back and Neck Pain Center in Newark, Delaware. And what you're watching is an example of our X-ray report of findings. So this is what we do for every patient that comes into the office, and we've kind of created a sample patient for you to view our procedures and determine how we evaluate people's spines. So often our patients will come in complaining of low back pain, neck pain, headaches, things like that, and they say that they feel like their spine is out of alignment, that there's too much tension or pressure there and it needs to be released. So while that statement is pretty accurate for a lot of people, it doesn't necessarily go into the specifics of, if my spine is out of alignment, which direction and how much, and what do I need to do to get it back to normal or regular alignment. So what we're going to do is evaluate this patient together. This is a female patient, and we start by looking at the neck from the side. Now, the way the system works is that the picture on the left is our normal stock photo. This is our reference point for a perfect cervical spine. Great alignment, great anatomy. Everything here is where we want your spine to be and how we want it to look. This is how our patient's spine does look. Red line is where they are, green line is where they should be. So the first thing we notice right off the bat is how much of an alignment shift this patient has. This ideal C-shaped curve that we see over here has essentially been reversed. Now, the most interesting thing about this patient is that despite that big alignment shift, there are no anatomical red flags, meaning that if this patient went to a hospital with neck pain and they were evaluated, there wouldn't be any evidence of bone fractures or dislocations or bone tumors or arthritis. So they would essentially, from an anatomical perspective, have a normal looking spine. So that's true, but despite how the anatomy looks, it doesn't indicate how this area functions or what the biomechanics are. And that's what we do as chiropractors. See, this alignment is very important because changes in it or a loss of that alignment, the loss of that normal curve, creates increased stress on these joints. Increased stress leads to decreased motion, and those two things together lead to a faster degenerative change of the bones and joints through this area. However, it's the tissue that we can't see on X-ray that is infinitely more important. That includes your spinal cord running down through here, the nerves that come off at each of these levels and go down into your shoulders and your arms, as well as the discs in between each of these spinal vertebrae. Now, these tissues are very, very important, very sensitive, and capable of causing a lot of pain and dysfunction if they're compromised, irritated, or injured. As long as this spine is curved like this, this patient might go into different fluctuations of symptoms, meaning they could hurt more one day or less the other day. But as long as this is in here, this is essentially the problem that is creating the symptoms. Now, those symptoms can include, obviously, neck pain, but because of all the nervous system tissue through here, it can create headaches, low back pain, arm pain or weakness, tingling. We've even seen things like carpal tunnel from problems up here in the neck. So what our job as chiropractors would be is to adjust this area with this misalignment in mind, focusing on restoring that curve. And then when we get this area moving better, that's when we prescribe some of those specific exercises and tractions to retrain the muscles and ligaments through this region to better hold that improved alignment. That's the neck from the side. And this patient specifically has 106.0% reduction in their curve compared to normal with 17.8 millimeters of forward head posture. The next view we look at is the neck from the front, okay? This is the patient kind of facing the X-ray machine straight on. This is their left-hand side over here, and you can see, again, they're the red line, that they're tilted to this left-hand side. Just like the other view, when we move away from that center position, the stress on these joints increases, and then that translates out into all the surrounding nerves, all the soft tissues, all the muscles, ligaments, as well as the joints themselves. So this is so critical for us because as chiropractors, we now know which direction to adjust this patient, and we have an objective measurement of progress, meaning that as we get this neck closer to where it should be, this patient should feel better and function better. And not just temporarily, but for much, much longer than as long as the neck is like this. Here's the low back from the side. Now, the way this image works is you have your stomach over here, patient's back is right here, and their belt goes like this. So you're looking at the low back from the side. Now, again, this patient, you can see they're the red line, but you want to be the green line. There's a loss of curve again through here, 10.7% decreased versus how it should be with 12.9 millimeters of forward weight bearing of the rib cage relative to their pelvis. So what that essentially means is that their spine has moved a little bit too far forward and we've lost that curve. just like in the neck, when we lose that curve, it's going to put more stress on the joints. It's going to put more stress on the nerves that run through here, those muscles, those discs, and it could cause pain and problems for this patient. So we want to work to adjust this area, get it moving and feeling better, and then work with specific exercises and tractions in mind to help retrain these muscles and ligaments. Here's their low back from straight on. This is their left side over here. And again, you can see a little tilt off to that left-hand side. Now, this isn't necessarily qualify as a scoliosis, but it's a convexity in that direction that should not be there. We really want to see this patient be straight up and down. And again, just like when we saw the neck from straight on, we now know which direction to adjust this patient. We want to push this spine from left to right and then help to better balance out this pelvis to reduce any incidence of pain they have in the low back or potentially shooting down the legs, any pinched nerve pain down here. If we can help improve the function of that spine, better function will lead to better feeling, less pain, less symptoms. So this is how we evaluate spines. If you have any problems in your back, neck pain, low back pain, headaches, pinched nerve pain, those are the things we get better, and that's what we work on every single day. If you're interested in seeing what your spine looks like, what your alignment is compared to normal, please give us a call. We'd be happy to help you. Mention this video, and we'll give you a free consultation. Thanks a lot.